Good afternoon. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. It is March 14, 2024. Thank you. We have our final surgery for today. This patient comes to us from Boston. He has back pain. A little bit of numbing medicine going in. He has a couple of herniated discs. A little bit of numbing medicine going in. Little stick and burn. Thank you. Everything's fine. You're doing great. We're going to be fixing one of those discs today, L4-5, on both sides. He's already been positioned, prepped and draped. Shot. All right, I'm going to put some numbing medicine. You know, I'm wondering about this drape here, Luis. I wonder if we can do without the IOBAN.
Without that, we can?
Yeah, I mean, it's really more for fusions rather than these procedures. I think it just gets in the way. Okay, you can see, show us the L4-5 disc, Jordan. Correct. Shot. Our first goal is to get there through the foramen. It's called transforaminal shot. The name of the procedure is the Deuk laser disc repair. We're going to be fixing both sides at L4-5. Num. Shot. He has a tear in the L4-5 disc on both sides. That tear, we call it an annular tear. A little numbing medicine, and the tear has now a hernia coming out of it. So the tear in the wall is there to hold the jelly in place, called the nucleus, in place. And then when you get an injury to that wall shot, then it can actually leak out the jelly. We call it jelly, but it's not really jelly. And that's called a herniation. So everybody is focused on the cap, the top of the herniation. Where do you feel that?
Where are you feeling that, my friend?
In your back? How long has he had back pain?
Yes, he's feeling it for 4 years.
4 years. Thank you. So he's had back pain for 4 years, folks. You've had back pain for 4 years? How about before 4 years? Did you have it? Off and on? So he's had really constant pain for 4 years. And when I asked him where his pain was, he said here, but more than just here. This is L4-5. And he had a tear on both sides with bulging herniation. Are you comfortable? Any pain? No?
Any pain in your back?
Do you have any pain right now? All right. How bad is that on a scale of 1 to 10?
6 or 7.
7? That's the highest it went? Is that where you get your pain? All right. When you wake up, we'll be done with your surgery. Huh? Yeah. Yeah, he jumped. You could see his back tighten up. So clearly it hurt. We just tested his disc, and certainly he's going to sleep, right? Yeah, we're ready. We're done. He definitely had pain at the L4-5. And you can see on the x-ray the dye. Look at the dye. Take another. Is that x-ray? Can you see that, Henry? Look at all that dye.
Yes, we can.
It already leaked out of his disc. As a matter of fact, when I pushed it in, part of the reason he didn't have higher pain was because it leaked out so fast because his tear is so big on both sides. He's got a massive annular tear, and the nuclear material, the herniation, is stuck in there holding it wide open. And that's where his pain's coming from. So we're going to go ahead and fix that today. And he'll go back to Boston, hopefully a happy man. and his wife a happy wife. You know, pain affects more than just the person suffering with the pain. It affects all the people around them, their family, their friends, co-workers, relatives. Am I going too fast for you? Can you see the herniation? Show us the herniation there, Jordan. Henry, go to the x-ray. Take a look at the herniation.
We can see it.
See that? That shadow?
Yes, we do.
I mean, it's not even a shadow. It's an empty void area. That is the herniation. And the dye is staining around it. All right. Any questions?
Yes, we got so far 3 questions. This first one comes from Nicholas on Facebook,
Hi, Nicholas.
saying, I have 2 rods and screws in my thoracic and lumbar
Yep.
around T2 to L3 or L3 that would that prevents me from being a likely candidate for this DLDR on my cervical neck.
No, you're not. Okay, if you have pain, you're a candidate. And whether it's the DLDR or the DPR, one of our 2 treatments will fix your pain. We just need to know where your pain's coming from. So do the MRI review, and I will be able to tell you, most likely at the end of that Zoom meeting with me, in 5 minutes, I'll tell you where your pain's coming from. Once I know where your pain's coming from, I'll tell you how to fix it. Because there's only a few things that cause pain. And if you know those things, which we do at Deuk Spine, you know how to fix those things. So if I can identify your pain source, I can fix it. I need the irrigation on, guys. And I can tell you where your pain's coming from, usually on a Zoom call. Grab her. Now sometimes I can't tell all your pain sources over Zoom. Okay, Zoom is obviously great, but it's not perfect. The best is to have the patient here with me so I can touch their back or neck and feel things, because certain joints that are hurting have a certain pain pattern on exam, and the only way you can know is to touch. That's why the physical exam is so important. Are you on the right setting?
Yes, 45.
Just seems to be going faster than normal, but
A lot of surgeons don't even examine the patient. They just focus
yeah.
on the MRI, 1 and 2.
Yeah, Dr. Berndes is right. A lot of spine surgeons don't even examine the patients. They just look at your MRI. And you're never going to figure out where someone's pain is coming from their MRI. MRI will never tell you where pain comes from. Never. Never, never, never. Unless you have a fracture and everything else is fine, and the only thing you have is a fracture, then the MRI will tell you. So if you've never had pain before, you get into a car accident, they get an MRI, it shows a fracture, everything else is normal, then okay, your fracture is probably causing your pain. So the MRI is a good indication. But still, the MRI doesn't tell you where pain comes from. The patient does. And doctors can be fooled if they just look at MRIs. You will be wrong 90% of the time if you just look at an MRI. You've got to examine the patient with your hands. You've got to have the patient help. You need their input. After all, it's the patient who's feeling the pain. If you don't ask them where the pain is, oh, look at that. You guys see the red area up there?
Yes, we do.
That is the source of this person's pain. That's the inflammation we talk about in our videos. Let's show the video on how a herniated disc causes pain. And remember that picture right there, guys and gals, because that is where the pain comes from, the inflammation in the annulus. Go ahead. All right, now that you've seen the animation, you know what I'm talking about. It is the inflammation within the tear of the annulus that causes all the back pain. And we just found it. In this case of this disc, from the left side at L4-5, you guys saw that reddish pink area. That is not normal. That normally the annulus is white, completely white. And you saw that reddish pink area, that's inflammation.
We have a couple of questions.
Sure.
This first one comes from Lubisa on Facebook.
Hello, Lubisa. How are you?
They ask, hello, why do many neurosurgeons suggest fusion as soon as they see a black disc?
That's a great question. The reason is because that's all they know how to do to fix that black disc. So, first of all, you're right, Lubisa. Is the black disc the cause of the symptoms? That needs to be verified with the patient. But let's assume for a moment that the black disc is the cause of the patient's back pain. Then the fusion is the best treatment if you don't know how to do the laser surgery. 99% of spine surgeons, they don't know how to do this laser surgery. They only know how to do fusion. So fusion is the next best treatment. That's probably why they're suggesting it. And fusion makes a lot of money. I make far more money doing fusion than I do laser. Fusion is the highest paying surgery you can do. And it's not just neurosurgeons, it's orthopedic surgeons too. Especially those orthopedic surgeons. You got to watch out for them. Just kidding. It's neurosurgeons and orthopedics both. They're both equally bad. I've been trying to teach them this technique for years. They don't want to do it. They don't want to learn. They just want to do what pays the best, which is the fusion. So, what can I say? I'm ashamed of my colleagues. But I used to be just like them before I did laser because I didn't know any better. They know better because I've been telling them, but they don't listen. So I think it's greed and I think it's ignorance. So greed and ignorance are the two reasons. Huh? It's hard to learn new things, I agree, but yeah, they don't want to deviate from what they're trained to do. Listen, I agree there's excuses, but this is medicine, and medicine is supposed to be a science. That's right. You're supposed to be able to willingly evaluate new technology and assess it properly as a scientist to see whether or not it's of value in your practice to your patient. Yeah, that's right. So, while I don't feel any empathy for them, I don't feel sympathy or empathy for the doctors that are not willing to learn better technology for their patient. I hate them, to be honest.
I'm not really making excuses for them, I'm just trying to think what they're thinking. When they look at what's going on with them.
You know, when I encounter something I've never seen before or, you know, is foreign to me that could potentially be of value, I approach it with a sense of humility and openness to at least assess it, right? To see whether or not it makes sense logically that it could even work. And then I like to see actual results. When I approached this surgery, I was that way. I was, first of all, I was scared, terrified to see it being done because I'd never seen anything like it. But I was open-minded enough to say, okay, could this actually be beneficial to the patient? And, of course, when I saw great results, that's what changed my mind, was the results. Well, I've shown the surgeons the results. They're far better than fusion. And they still choose to do fusions because the money is better. And I can't forgive them for that. All right, this is it. 1 minute, we'll be done with this side. We're going to go to the other side.
That's not only the results, but the complication rate is so superior.
That's part of the results. The results are the good effect and the bad. You know, all of it's part of a result. So they're exposing patients to unnecessary risk of complications and poor outcomes for no reason other than financial for themselves. And that, to me, is a scam. A spine scam. Somebody should make a movie about it someday. All right. The nerve is there in the fat. You can't see it, but it's there. And now we're done. By the way, the inside of the tube is 5.5 millimeters, so you see how small the hole is? Now that we remove the herniation, it's about 3 millimeters. It takes 1 year for that hole to go away. 1 year for your body to heal it. Scope off. We're going to go to the other side. I'm going to switch sides with Luis.
We have a couple more questions.
Yep, I'll take them.
This next one comes from JMC on YouTube.
Hello, JMC on YouTube. Welcome to our live stream. I'm switching sides. I'm going to leave his left side and go to his right side. Go ahead.
JMC asks, can you do this surgery on someone who's on a blood thinner?
Yes, we can, but we ask them to get off their blood thinner before we do the surgery. And obviously, if you're going to have surgery, whether you have open back surgery, big cut, big incision, versus this is a much safer and better surgery for somebody on a blood thinner, because the incision is so small and the trauma to the tissues is so minimal. What causes bleeding during surgery is trauma to the tissue. So because we're doing so little trauma to the tissue, then there's little bleeding, because we're not cutting the blood vessels like they do with open back surgery, like laminectomy. Hey, let's show our audience what laminectomy looks like so they could understand the difference between what we're doing here, shot, versus laminectomy. We'll have some fun with them. I hope you enjoyed this video. This kind of shows you what happens with a microdiscectomy. And we're going to bring in next week, some of our laminectomy videos. By the way, all of our videos are created here at Deuk Spine. And yes, I've done laminectomies in the past, many of them. So we're going to bring in some of our laminectomy videos next week so you can see. You see how much more invasive laminectomy is. But listen, if you have, we just did a patient with blood thinners, was it this week on Tuesday?
Yep.
Right? He had a stent.
He did very well.
He did fantastic, yeah.
Yes.
I mean, he was a train wreck medically, had defibrillator and stents, and
Well, we got him optimized, we got him to the right doctors, and we
That's
got him
right.
twice a year. So
We did a lot of work the days before surgery. You know, getting him in to see the right doctors, getting medical clearances, tests done,
A lot of preoperative planning.
optimizing.
Everyone pulled together.
Yeah, team did a great job. We really care about our patients and we want them to do very well, not just from a spine standpoint, but from a medical standpoint, getting through the surgery safely without complications.
I go over the top with the internal medicine. Every patient. Make sure they get a great result.
That's right.
And a safe one.
Yeah, that's what it's all about, safety. We got 10 minutes max and we'll be done.
He's doing very well.
What other questions do you have, Henry?
These next questions come from Jeff on Facebook,
Sure.
asking, what about Parst effect? I have middle back pain / stiffness after I walk. Is this normal after an L5 to S1 fusion? And can I get this laser treatment after I had a fusion, or is it too late?
No, Jeff, we can fix your back pain, period. It's not coming, if you had a fusion at 5-1, it's not coming from 5-1 because there's no movement at 5-1. Your pain is either SI joints, which is below 5-1, or it's going to be your facet joints at L4-5, possibly 5-1. I can tell you exactly what's causing your pain if you do the MRI review. It's free. We don't charge. Just fill out the form, send us your MRI, and probably next week you'll have an answer. What's causing your pain? More importantly, you'll know exactly what needs to be done to fix it. I could have your back pain completely gone within 2 weeks if you're motivated to come here and get it done. Okay? But if I had to bet money, your pain is either SI joint, piriformis, facet. One of those three. Or it could be your L4-5 disc. So it could be the disc above 5-1, L4-5. It could be the facet joint above your fusion, L4-5. It could be your SI joint if it's below your fusion. And it could be your piriformis muscle if it's in your buttock. But I will be able to tell you exactly what's causing your pain. And it could be all of the above, by the way. Get answers. Don't guess. 5 minutes. This is the herniation right here. I've already cut part of it off, and I took it out just a few minutes ago if you're watching. See how scarred it is? It's stuck, and it doesn't want to come out. So the only way to get it out is with the laser. People say, oh, is a laser really necessary? Yes, it is. There's no way you can do this properly without it. If you just use grabbers by themselves, they don't work. A grabber cannot generate enough force to rip out the herniation when the herniation is scarred to the annular tear. You must have a laser to release it. That's why the laser is so valuable. It's valuable because it frees up the herniation fragments off of the annular tear. We call that a debridement, D-E-B-R-I-D-E-M-E-N-T, or a debridement, depending on your accent, right, Henry?
Yes, I know what you mean by that.
Any more questions?
Yes, we have another question from Nicholas once more on Facebook,
All right, Nick, bring it on.
asking, would we have to do MRI with contrast as we are
No.
fused and can get a referral?
No.
letter? Okay.
Absolutely not. No MRI with contrast. You never need that. Okay? The only time you need an MRI with contrast, all right, to be honest with you, I know all these surgeons like to order it. If you've had back surgery, they want an MRI with contrast. You don't need it. The only time you need an MRI with contrast is if we're worried about a tumor, a spinal tumor, which I'm sure you don't have, or an infection. A tumor or infection, that's it. Now the reason why doctors order it all the time, contrast MRI after surgery, is they're looking for scar tissue. That's the way I was trained too, okay? But it's a BS reason. Don't do it. You don't need it. I got 3 minutes left. Burndes, 3 minutes. That's fine. We're almost done. The disc tear is, the end of the disc tear is right here. All right, next question. So contrast you do not need on an MRI, even if you've had spine surgery. And other doctors may order it, but you don't need it. Not at Deuk Spine. It's a waste of money, but more importantly, it's a risk to the patient. Contrast can cause pulmonary fibrosis, lung fibrosis. MRI contrast. It's dangerous stuff. You don't want it.
Next question from Jeff, once more on Facebook, saying, I appreciate your help and thanks for taking the time to respond.
My pleasure.
Is this a one-time treatment?
Yes. These surgeries you're watching, all of them that we do, are permanent treatments. We don't believe in doing treatment that doesn't last. The laser disc repair is permanent. The facet Deuk plasma rhizotomy, permanent. The Deuk piriformis release, permanent. Permanent pain relief from those structures. We're the only place in the world that gives you permanent pain relief. Everywhere else you go, they're going to want to do treatment after treatment after treatment after treatment after treatment for the same problem. We don't do that. We have found the cure to each problem. We just need a diagnosis, and we know exactly what to do. Grabber. A lot of scarred up herniation here. It's really stuck, doesn't want to come out, and I'm having to hit it with the laser pretty hard. You see, you can go in there with the grabber, but it doesn't bring it out. You really got to use the laser. Yeah, we're almost done. Just got a little bit of fat in here. Why is there so much fat down here? Well, the reason is simple. Inflammation. Inflammation is very, very energy expensive. Your body uses a lot of energy for inflammation. It's like fighting a war. The last time we went to war in the United States, the Gulf War, we spent $3 trillion a year on the war. Most Americans don't even realize that. Most of it went to a company called Halliburton. Halliburton, by the way, ended up paying for George Bush to come and give talks at $1 million a talk when he finished being president. Did the same thing with Bill Clinton. Can you imagine being invited to give a talk for an hour and getting paid $1 million? I have to pay people to come hear my talks. What's so special about the president giving a talk that they should get paid $1 million when they used to be the president? Well, obviously they're doing favors for those companies while they're in office. Just corruption, corruption, corruption. All right, here we go. Last bit and we're done.
We have a comment from Nicholas, once more on Facebook,
Sure.
saying, as I also get neuropathy and radiculopathy in my legs and feet, not sure if it's coming from my neck as well, but I want to make sure I already have a referral for cervical MRI. I can't get the lumbar MRI without a referral letter here in Trinidad.
Aha. I wish I could help you, my friend. I'm not sure what to tell you. We do have patients from Trinidad. And patients from Tobago. Yeah, we just had a patient from Trinidad. Huh? Yeah, we had I think it was a doctor, yeah. Can't talk about it though because I don't want to give away any information. Patient confidentiality. 1 minute. Any more questions, Henry?
No current questions, but we do have a comment from Jeff on Facebook once more saying, I'll take $1 million to make talk.
Take $1 million what?
I'll take $1 million to make
Right.
talk. Yeah.
Right? Who doesn't want $1 million to give a talk? So, obviously,
Agreed.
you gotta do a lot for a company to get $1 million bucks. And what did George Bush do? He went to war. He took America to war. And he got paid well for doing it. My least favorite president of all time used to be Jimmy Carter. But now, good old Georgie boy. I just want them to be honest with us, you know? All of them. Honesty.
You ever read the book The Whole Truth, Dan Kuntz?
No.
Reading all eight, I guess.
Dean Koontz?
Yeah.
He's normally a horror writer.
Yeah, well, this was gonna end up in a horror movie.
Yeah.
The book was about a guy that he sold ammunition, so he created a Cold War, basically.
Mm-hmm.
And that way he was able
Scope
to
use,
sell
7.
arms to multiple sides.
Yeah.
Yeah, it's very interesting how they did it. They created
You ever see an old movie called A Fistful of Dollars?
I know the movie, but I haven't seen it.
Clint Eastwood. Go watch it. Playing both sides.
Yeah.
Creating a war, and of course him benefiting from the war.
Yep.
From both.
This book was really good.
All right, we're all done. We've did L4-5 on both sides, and you could see the tears and the herniations and the inflammation, and we cleaned it all out. So it went perfect. Any more questions?
No current questions.
Great job, everyone. We finished before 3. I'm impressed. We'll see you all next week.